The Ecosystem Revolution, Healing Healthcare's Fragmented Cosmos with Ethical Digital Supply Chain Competences by Dr. Patrick Schur, professor in EDSC at the C-WIN Lab, founder of the C-WIN Solutions in California at alias Kepler. Healthcare data is trapped in a technological time warp. While we can order anything to our doorstep in minutes, most hospitals still rely on fax machines to share critical patient information. But what if there was a way to give every person complete control over their medical history? Imagine a world where your medical data doesn't live in siloed hospital servers or static screens, but moves with you, like a good digital shadow and personal ambient, synced to your biometric identity. A world where emergency rooms already know your allergies before you speak. Where interdisciplinary teams collaborate not through fax machines, but through a patient-controlled and trusted doctor-assisted medical passport. Today, we explore the Ecosystem, a $20 million innovation project bridging Dr. Patrick Schur's supply chain patents in collaboration with ETH Zurich, ethical design, and the disciplined habits needed to transform any healthcare services in the world for a secure and mature transition. With me is Dr. Schur, who argues this isn't about technology, but about rewriting the culture of trust. You've said, digital follows you, biometric and addressable, not static, not delegated. Break this down. Why is ownership the first principle?
Jessica, today's healthcare is a museum of fragments. Your data sits behind glass, static, brittle, controlled by institutions. The Ecosystem flips this. Your records are a river flowing with you, not because of biometrics alone, but because you steward access. Think of it like your morning coffee ritual.
Coffee?
Yes, you grind beans, boil water, discipline steps, but the system, your kitchen, adapts to you. Healthcare must mirror this. Structured enough to save lives, flexible enough to follow patients. ETH's patents solve the how. The barrier? Human resistance to relinquishing control.
It's never about delegation. It's about 360 degrees 4D trust. You call this an Apollo 13 mindset. Improvised, urgent, yet systematic. But hospitals aren't spacecraft. How do you adapt without chaos?
Apollo 13 didn't redesign rockets mid-crisis. They repurposed existing parts. Our parallel system approach. Build the co-internet alongside legacy records. Prove value in emergency room first. See? This saves 12 minutes per stroke patient. Then scale.
Like a startup iterating in stealth mode?
But with hospital-grade rigor. We need organizational bilinguals, doctors who know code, regulators who understand no-code DevOps. That's why we're endowing a professorship. To breed hybrids who speak both languages. The graphic analogy I use, eye bubbles connected jet float on the water ear, like adding a new OS layer beneath Windows. No disruption, just gradual, irreversible utility.
You've called bureaucracy the human firewall. How do you bypass it?
Not bypass, reprogram. Fear of change melts when you show, don't tell. In our digital land, we piloted a dental Ecosystem node. Dentists saw kids' vaccine records instantly. Suddenly, they demanded expansion. That's the playbook. Small wins, then viral adoption.
And the patient role?
They're the root user. Imagine a traveler with diabetes collapsing in Tokyo. Today, chaos. With Ecosystem, paramedics scan any palm, see her data, her directives. No bureaucracy, just care.
There is hope for human centricity. Final question, what's your intelligent golden sentence for skeptics?
Static systems create fragile humans. Flowing data heals. We're not just building tech. We're building trust infrastructure, one disciplined step at a time.
Dr. Schur, thank you for breaking the fragmented cosmos. Read more under www.artofdigitalshadow.org.